Today we will discuss about symptomatology about palpitation. When a patient presents with palpitation, what are the things to be asked and what we will gain from those questions? So we'll start now. So when patient presents with palpitation, first thing what you want to ask?
Sir, I want to ask about onset of the symptoms, sir. It can be two ways, sir. Whether it is abruptly onset or insidious onset. Abruptly onset more often associated with any pathological conditions.
Okay. So any abrupt onset palpitation is pathological. Then?
Sir, then if it is on gradual onset, then first ask if it is on severe exertion or on minimal exertion. If it is on severe exertion, we'll think it goes more in favor of physiological phenomena. Or if it is on minimal exertion, then we'll think of any pathologic conditions like anemia, thyrotoxicosis.
Okay. So, if the individual is getting palpitation on minimal exertion, you have to think of some underlying lesions like anemia, thyrotoxicosis or cardiac abnormalities. Then what question you want to ask?
Sir, whether it is regular or irregular.
Okay.
If it is irregular, I would like to think about a pathological condition underlying. It can be like atrial fibrillation.
Very good. So, irregular palpitations are pathological most often. So, next question will be about?
Sir, after onset and regularity, we'll check for how it stops, sir. Whether it's abruptly stopped, it's again more often related with any pathological conditions.
Once we assess about the method of stopping palpitation, then next question will be about?
Sir, we'll ask if it is recurrent or not, sir. If it is recurrent, then we'll think of any pathological conditions like atrial fibrillation or atrial flutter, sir.
Okay. So, recurrent palpitation is a clue about some arrhythmias. The next question will be?
After this, I want to ask about any associated symptoms like throbbing pulsation in the neck, which is usually associated with aortic regurgitation.
Okay. Palpitation, if it is associated with throbbing sensation in the neck, commonly it is aortic regurgitation.
We can ask about slowing of the palpitation, sir. That will suggest you.
If the palpitation is slow, it is suggestive of heart blocks.
Sir, then we'll also ask if there is any pause between the palpitations. That will suggest us to look into any compensatory pause after any extra systoles.
Okay. So, any abnormal pause in between the palpitation is a clue about compensatory pause of extra systole. So, these are some questions which we have to ask when we are assessing palpitation to know whether it is physiological or pathological. And here comes a common favorite question of examiners, that is tapping method in palpitation. So, we have to ask the patient to tap and explain how is the palpitation. So, if he taps fast, then it is tachycardia. If tapping is slow, then it will suggest some heart blocks. If the tapping is regular, it will suggest some conditions like aortic regurgitation. And if the tapping is irregular, that will give clue about many arrhythmias such as atrial fibrillation, atrial flutter or any extra systoles. Two more favorite questions of examiners related to palpitation are: what is post-palpitation diuresis and what is the relation of vomiting with palpitation? So, post-palpitation diuresis, see if the palpitation might be because of atria or ventricle. So, in both cases, there will be release of ANP or BNP. So, these natriuretic peptides will lead to diuresis after the palpitation. Coming to vomiting relation with palpitation, if palpitation resolves after vomiting, it might be a clue of PSVT, paroxysmal supraventricular tachycardia. So, because of vomiting, there will be stimulation of vagal nerve. So, that will lead to stoppage of palpitation. Now, the question for you is, what are the drugs which will lead to palpitation? You can comment those medications in the comment section. Thank you so much.